This is Dr. Birchler from the Chiropractic Health Center. What you're looking at here on the screen are picture representations of what are called disc herniations, some different sorts. And this is a common condition. Lifetime incidence of disc herniation is estimated to be about 35% of men and 45% of women. And roughly 50% of people in their lifetime will have sciatic nerve type of pain, severe pain going into the leg from the back. So these can be debilitating things, painful things, and somewhat common things. A lot of people, when they hear about a disc problem, a disc herniation or something, they assume that somebody needs to have surgery for that because they've heard that so and so had surgery when they had a disc problem. And yet at the same time, not a lot of people really want to have back surgery, and probably a lot of people have known people that had surgery and wish they never had it, which I've met many of those people. What that looks like on a model here would be something like this, where if you take the vertebrae out of the spine, you have these bones and a cushion between the bones called a disc, and this shows it on its end, so kind of like the picture shows, almost like a jelly donut. And this shows the jelly as red. In real life, of course, it's not red, but for effect on the model, it shows the jelly kind of blowing out of the donut towards where the nerves, spinal cord space or spinal canal is, and the nerves come out that go down to the legs and the feet. So that's what this is showing or representing there. And why is this important to go over? What I'm going to go over is really how to treat disc herniations naturally, without surgery, and some of the mechanisms involved in that and what is effective. So first off, why is that important? Well, it's very common, and this is one of the largest study that I've ever seen looking at the rates of death from back surgery. So over 800,000 people studied from hospital records and that kind of thing of where they did the surgery. And what this is saying here is, out of all people that have back surgery, just over 1 out of 1,000 people die from back surgery. Now, it might or might not sound high. It's not 1 out of a million. You're talking 1 out of 1,000. And for people that are having just discectomies or maybe what are called laminectomies, it's maybe slightly less than 1,000, maybe 0.8 out of 1,000, or a little bit less than 1 out of 1,000, and still pretty high. And for people going through this, like if I was to have that decision right now, have 5 kids at home and a wife, there's no way I'm taking 1 out of 1,000 chance of dying from surgery. I'm going to do whatever it takes, even if it takes some time, to be able to get through that without risking that. So that being said, what are the estimations of having a successful non-surgical improvement with these disc problems? Well, probably on the very low end from published research, you'd have 60% of people are able to do something conservatively over a couple months of time and get a result. They feel like, hey, I'm doing well enough, I'm not going to go through with back surgery. And for people that actually specialize in dealing with these disc herniations, I would say it's closer to 90% of patients that are able to hang in there, go through protocols, get enough relief that they say, hey, I'm not doing disc surgery, and they end up carrying on and never having the back surgery. So it's actually the large majority of people, even with these verified, like you can see it on MRI, like they have a disc herniation, they have a bad problem there. They're able to get through that without surgery. So it's not it's not like occasionally you can have this happen. It's most of the time, the large majority of the time, this is possible. Though it does take time. It's not that same like you go in and have a back surgery and 4 hours later you come out and it may be reduced. It takes weeks to a couple months for things commonly, but it is a legitimate non-surgical option for people, right? So let's get into what actually happens here. Let me show you this for a second. So this shows a disc where it has had a herniation and has actually come off or broken away from the disc. That's not very common, but for effect, I'm going to show you that, because if that happened in the body, understand the body is living. It's a living thing. It's not a machine. This was a car or a machine, you'd think, well, yeah, you have to go in and cut that out or something like that. But the body is living tissue, and so when something like this happens and you have this chunk of stuff that should not be there, the body recognizes that shouldn't be there, and then it actually brings the immune system or immune cells in there, and it starts to kind of eat it up, almost like it would an infection or foreign material. Thing is, that takes time. and that process of that occurring involves certain chemical inflammatory mediators, and is very, very painful. So the body puts you into very much a protective guarding mode. It's very painful, very limited ability to do anything, and it's like the body says, you do nothing, don't move, don't screw this up, don't make anything any worse, and I'm going to put you down for months or however long it takes to get this thing eaten up. So the time frame that takes, based on data, might be that say 60-75% of people that don't have surgery that hang in there for a long period of time, they may get a substantial reduction of the size of that herniation in 6 months, 12 months, or a few years. But that's a long time to hang in there if you're trying to work and earn a living, take care of a family, especially if you're in a lot of pain there. So being able to shrink that time from, say, a year or so to, say, 6 weeks instead of 6 months is kind of what the non-surgical mechanisms of disc treatment achieve. But they have to do it through something from the outside, some kind of mechanical, non-invasive thing. So let me show you the picture representation of the known mechanisms involved in this. So if you have a disc that herniates, what actually happens is the immune cells actually have to come in and start to what they call resorb, or kind of eat up the disc herniation, and almost like clearing an infection in the body. Right? Here's one of the problems, though, is the disc does not have any blood supply to it as an adult. It does. It's known to have some blood supply through puberty, but not into adulthood. That happens somewhere around puberty. So it can't, you can't have like you could with a cut or something that bleeds, like the immune system gets in there and clears it up real fast. It doesn't happen that way because there's no blood supply. So the things that actually are effective in terms of helping it to speed up the process are things that physically cause a kind of mechanical pump. That's how the disc actually gets fluid and immune cells. They kind of kind of diffuse in and out of there. And the thing that speeds that up is mechanical movement or pumping. So the mechanisms that are employed for non-surgical disc treatment are some type of mechanical pumping, stretching. We use what's called spinal disc decompression, which actually lets creates a negative pressure. So whatever is bulging out or herniating out of the disc, it creates a kind of suction towards the center, allowing it to kind of suck back towards the center. And in the process of doing that, if you were to see the spine, this shows vertebrae, and there are nerves coming out of these holes, and so it uses this mechanical mechanism to cause a separation like this, opening up the space around the nerve repetitively. And this represents the disc in here, and so it takes that disc and it kind of pumps it like a sponge. It pumps it open and close, forces fluid in and out of the disc. And I use the analogy of like a chemical reaction. If you want to if you put chemicals in that are going to react, they'll eventually react. But if you put chemicals in and then you stir it, it'll happen faster. If you're going to bake something, you can put the ingredients in and they'll kind of maybe soak in or whatever, but if you put it in, then you mix them up and you stir them, it'll happen faster. So the body has to kind of heal or resorb whatever the injury is in the disc, and it does that through the immune system, just like any other injury, like a cut or a broken bone or something. Like, the body's going to repair it, but this mechanical action of pumping and moving that disc is really kind of what speeds up that from happening compared to what it would just do without having that type of a treatment. Okay, so that is the basic mechanism that comes into play and how that works. It's called imbibition. It is a mechanical pumping that causes exchange of fluid and nutrients and the immune cells and things in the disc. So it's different than blood fluid. It's called imbibition there. Okay, so what we do is we use very specialized equipment that looks like this, where a person lies comfortably on a table. They're connected with, their body is harnessed, they're connected to a tower, The angle of the direction of that pole is specific to where the problem, which disc has the problem. And then the table has specialized features and tracks that allow it to just gently slide and kind of have this repetitive pump open and close, which is shown on this screen here, where there's a precise force profile that causes it to kind of open and relax, or stretch and relax. And it does so without the muscles of the body being able to tense or spasm. And it achieves that because there's a very sophisticated two-way motor system that creates an exact force profile that occurs where the body is not able to have muscular contraction. It kind of tricks the muscles, so it allows things to just kind of open and separate without the body, which is in a lot of pain, guarding and spasming typically. So that's what the equipment looks like. Then as a person gets better and improves, we recommend to, at home, use what's called a wobble chair. And this is a patented device with a circular ball bearing, which is designed to look kind of like be the size of the fluid center of the disc, so to speak. And as a person is getting more pain-free and the problem is getting better, it allows that person to go through multi-directional motion of the disc to improve mobility, to actually create some of that kind of imbibition type of effect at home on their own. But at the beginning, it's so painful to even move the spine in cases like this that they can't even do that. And one of the incredible things with the spinal, what's called spinal disc decompression, is if you can imagine this red goop of jelly bumping into the nerve here, if you could just pull that goop of jelly kind of away from the nerve that's going down the leg, and you could mechanically just move it just a little bit off the nerve, that can turn severe, horrible pain into feeling like, oh man, I got some relief there, and you get some relief. And so you have to do that at the beginning to physically, mechanically pull the pressure away from the nerves. And then speed up the time, the rate at which the body is actually able to get fluid and immune cells in there to resorb that. But ultimately, it's up to the body to to resorb that and more or less make it new or resorb it from the inside, and avoid all the risk of the surgery and the risk of dying and all these kind of things. Thing is, it takes a little bit of time there. So anyway, I hope this is helpful for people out there. I know this is a major issue in people's lives when this happens. It can be debilitating, can affect your income, can affect your self-worth, your ability to do anything, and not everybody will have somebody that sits down and kind of explains this or is aware of non-surgical options. If this is something you're dealing with, we'd be happy to review any MRIs, happy to evaluate you, talk about what outcome you may be able to expect in your case, and certainly if it's something we think we can help, give you recommendations and a plan to do so.